Wild Health is about optimizing you. We use genomics, blood work, biometrics, microbiome assessment, many other tests, and a conversation with you to come up with a full health optimization plan. What's the perfect diet, exercise, and supplement plan for you and only you? The Wild Health podcast is about optimizing all of us. Here we cover the cutting-edge science that gives you the base to be able to apply the personalized plan we give you as a patient. To sign up as a patient, go to wildhealth.com. Or if you're a physician or health coach and you want to learn how to do this for your patients, we're happy to help as well. Wildhealth.com for all the information on becoming a patient or working with us.
All right. What's up, guys? It's Erin Faules, formerly known as Dr. Erin Donaldson on the Wild Health podcast. But go by Erin Faules, my married name now. I am here with the esteemed Jeff Graham, one of my good friends. So Dr. Jeff Graham is a premium physician and medical director at Wild Health. He earned his medical degree from the University of Arkansas, completed his family medicine residency at the Mountain Area Health Center in North Carolina, where he also completed a sports medicine fellowship. I didn't know that.
Yep.
Dr. Graham also holds a Master's of Public Health from the University of North Carolina and is board certified in lifestyle medicine. With professional experience in sports medicine and functional medicine, he is an avid CrossFitter, dedicated to helping patients achieve better health and well-being. Dr. Graham resides in North Carolina and has interest in elite athletics, outdoor activities, and health span optimization. And for those of you who have not met Jeff personally, he's also just a super awesome human being, one of the nicest people in the world. And my husband would say he has one of the coolest trucks he's ever seen. He still talks about your truck.
Man,
So
you don't know what an ego boost that is, because we've been arguing in the house about whether to sell it and look at a new
I think we would have a
EV
buyer.
truck
Don't
or
tell my
something.
husband
Yeah.
that.
Well, I'm glad I know that now. Yeah, I'm gonna text Will and be like, "Hey, man, what are
Apparently
you
those
going
are
on the
very hard
market?"
to find.
They are, yeah, Excursions. Like, it's a 21-year-old Excursion, the diesel engine that's just indestructible. I think that's what Will was blown away by. Yeah. Yeah, that's good to know. Thank you.
Anyway, thank you for coming on. So Jeff's going to be
Yeah.
on the podcast with me a lot here. We're going to be talking about all things Wild Health coming up. But we just wanted to dive in today with you guys and break down some of the testing we do at Wild Health that we think makes us a little bit different. So we focused on really optimizing people's health and personalizing it, called precision medicine, right? We use your genetics in your lab to personalize your health plan. But we also use a ton of cool technology and in an effort to help you live well for a long time. Not just live for a long time, but live well and do the things you want to do for a long time.
Yeah.
So anything to add to that, Dr. Jeff?
No. I think you nailed it, Erin, like that last part. I mean, we say this until, it almost becomes just cliche at Wild Health, but who cares if you're living to 96, if you're in a wheelchair starting at 84? So we want our patients to have quality years of life. That's what's most important to us. So yeah, I love to focus on some of this advanced testing and technology we're using now to help ensure that our patients can do that.
Yeah, for sure. And, if you guys are patients here at Wild Health or even interested in what we do, my guess is you're going to know some of these are going to ring a bell for you. You're going to have read about them, heard about them, but hopefully we can answer some questions. Some of these are aimed at what we call early disease detection, or essentially, understanding your either risk for or detection of a disease much earlier to where we can take action and either prevent it or fix it before it gets super bad. It's kind of the layman's way of looking at that. And then there's also just some really, really cool technology to help optimize how your body functions. So both kind of optimizing you as well as preventing bad things from creeping in. I'm sure people that are listening wouldn't be shocked to realize that historically a lot of things are fairly reactive in some of these realms, and not for the sake of people not caring, in my, at least what I choose to believe. But, things like heart disease, as an example, which is the number one killer in men and women, is oftentimes people come in because they have a heart attack, right? Or they have chest pain and they have advanced cardiovascular disease, as an example. So that's just one example that probably most people have been personally affected by, either personally or known someone who has had heart disease. And we're going to talk about one of the areas of testing that we can really look at things in a lot more granular fashion a lot earlier to help prevent that from ever happening and to help prevent that kind of presentation, right? Because I think it's still I think still over half of the presentations of cardiovascular disease is just sudden death. So
Sudden cardiac
that
death.
just
Yeah.
needs to
Yeah.
change. So anyway, we're going to kind of break down a bunch of these different tests, but just wanted to give you guys kind of a preview of what that looks like.
Yeah, I
Cool.
agree. And I think that's an awesome one to start on if you want
Great.
to. Yeah.
Yeah, for sure. Let's roll into that. So again, cardiovascular disease, number one killer, right? So, and also just like a huge cause of morbidity or, a change in how people feel, right? I mean, if you are diagnosed with coronary artery disease and have to have like a stent placed as an example, you may still be able to go on and live your life, but maybe you're on medications for the rest of your life. Or if you have to
Yeah.
have open heart surgery, maybe you have to have, some modifications to your life. Maybe not with some of the ways things are done now, but it's not just mortality or how soon and how often people are dying, but also just we want you to live well, right? We want to prevent this if at all possible. So one of the coolest studies, I think, the coolest diagnostics ever that we have so far is what's called the Cleerly. You want to take this one, Jeff, or you want me to keep rolling?
Yeah. Yeah. I mean, I'll at least kind of describe the test. And like you said, I think it's probably, I don't know about you, but in my patient population, this may be the most common test that I order that's outside of, what we do as a whole at Wild Health. And I think it's because the bulk of our patients, or at least my patient panel, tend to be in this age range of 40-ish to 60-ish, kind of coming to figure out, hey, I want some more in-depth advice about how to live this next part of my life, how to optimize our longevity and keep me healthy through the 40s, 50s, 60s, 70s and beyond. In this test, it is a coronary CT angiogram, meaning that we do a CT of the heart, specifically to look at those three main vessels that take blood to the heart muscle. The right coronary artery, the left main left anterior descending, that is considered kind of the same artery, just different segments, and the circumflex. So, it's taking a very detailed look. It does use dye, right, because we want to see if there are blockages, and so that's what's different than the calcium study, the traditional calcium score everybody talks about. That's done without dye. It's looking for calcium, which in and of itself is not dangerous, right? That's kind of scarred tissue. We know it's stable. But that's why we really like this test, because this is not just looking at the calcium, but also looking for plaques and then breaking it down even further to look at the type of plaque it is. It actually, like you said, the term granular is a really good term to use here, because it's looking at whether this is a high risk, what we call low density plaque, and that means it's high risk because it's likely to break off and cause something like a heart attack, or whether it looks like it's a more stable plaque. So it really helps characterize any existing cardiovascular disease that that person might have.
Nice, yeah. So, like, if you guys aren't familiar with what plaques mean and what gets calcified, like if someone has had long-standing, like, plaques that are forming in their coronary arteries that get kind of hardened over time or calcified, like think very similarly to how when you get a cut on your skin, it's kind of like foggy and red and soft, and then over time it gets kind of fibrous and scarred, right? It's not
Yeah.
exactly the same thing, but kind of similar process. That happens in our arteries and they're very, very small, right? So it doesn't take a lot to disrupt that blood flow. If it happens slowly over a long period of time, and those are calcified and what Jeff is saying, stable, they're less likely to
Stable. Yeah.
rupture and become like an acute or a sudden blockage, right? That's where you get a heart attack. If you get a sudden blockage without extra places for that oxygen to get where it needs to go or that blood to get where it needs to go. If that has been happening for a long time, some of these people are actually at a kind of a paradoxical advantage because they've had the chance to build other blood vessels to get oxygen where it needs to go as their body's like, okay, I'm not getting quite as much blood flow through here. Let me build some other blood vessels. The body's super smart. What we kind of worry about more than people who have kind of like diffuse calcifications is people that have like a, like, 40% lesion in a big
Yeah.
vessel or something like that, where it's like and there's not a ton of other lesions. It's like, man, that could be just like a unstable plaque that could just rupture, and there's nowhere else for that oxygen to get where it needs to go, that blood to get where it needs to go, and the heart you could have a heart attack from something like that. And those are the things that can present in a super tragic way, like what we talked about. So these clearly tests uses the angiogram or the dye, like Jeff's saying, and also uses AI to further analyze these results. And in my opinion, I don't know if my cardiologist friends would be happy with me saying this, but in my opinion, it's like probably more accurate than a heart cath, where you're actually going in and doing dye and visually looking, because you're not going to have that human error. The difference is you can't then do an intervention. Like if you get a Cleerly test
Yeah.
that shows multi-vessel disease, oh, this needs a, stent or an angioplasty or a bypass, you can't go in and do that stent right then, right? You have to then
Yeah.
follow up for an
Yeah.
appointment.
Yeah,
So
100%. Yeah. Yeah, and I think that the way that we usually use these, because unfortunately, if you've had a heart attack or you've had an event, hopefully you're gonna be in the hands of a cardiologist, and at that point, I love what you referenced earlier, Aaron. We do wanna take a very natural approach to optimizing your lifestyle with lifestyle therapeutic lifestyle changes, right? But I have so many patients say, "Oh, I don't wanna be on this medicine or that medicine," maybe because they've read something in the media, and so I think to look on the other side of that, and you mentioned this, you and I have both managed people who have had heart attacks and they've survived them, but there is such significant morbidity. You know what I'm talking about. If you've had an MI, you're automatically going on at least 3 different classes of medications, 2 or 3 to preserve heart function, to let the heart muscle relax. You usually have some limitations with your ability to exercise anymore and keep yourself healthy. So the downstream effects of preventing that first event are absolutely profound. So I think to go back to what you're saying, like when we're doing these, we're usually doing them in the setting for primary prevention, right?
Mhm.
We've looked at someone's labs, we've looked at their genetic predisposition, and said, you've got a decent risk here, and maybe you're at the right age. We're not going to automatically shove a medication down your throat, because I think that is what people don't like about too often what we do in the conventional medical system. So we want to take a step further and do this study, which, because of, like you said, that AI overread is just so, it's amazing. And I agree with you. I argue with my cardiologist friends all the time. And I don't argue now. Some of them are coming around saying, yeah, those tests are pretty darn good. Because if we can diagnose it with something like this and treat it with either therapeutic lifestyle interventions, we have a more targeted approach. If we know you've got a significant amount of plaque in some of those arteries, maybe we assign new values to our goals for your lipids and for that high risk CRP that we're looking at, which is an indication of vascular inflammation. It just gives, in my mind, it gives me new benchmarks to shoot for with people when I have that information.
totally. And I think you pointed out a really great category of people of, maybe they're young, but they've got some serious risk factors, and not probably the conventional ones that you may have heard about from your primary care, like the ASCVD risk
Yeah,
calculator and those sorts of
exactly.
things, like kind of the classic, do you need a statin or not? Um, it's not that binary anymore. I mean, maybe it never was, but we
Yeah,
know so much more about other risk factors. Like we can look at your lipoprotein levels, we can look at your genetic predisposition. Like we put it all into a personalized big picture. And then we talk it out with you of like, hey, yeah, I know you're 35 or you're 40, but like you've got this, and this genetic risk. Your dad had this happen, you've
yeah,
got this marker, like this is kind of adding up to a concerning picture. We all have these areas, right? Like we all have
yeah,
areas where we need to be more supported. When we look under the hood this deeply, like we all have areas where we need support. We all have kind of
yeah,
superpowers is what I share with people.
yeah.
And it can be scary to look at it, but like this is just the most common thing that can come up. And so this is for that kind of person, diving a bit deeper and saying, is this going on or not? And how aggressively potentially helps us a lot determine, do we need to pursue pharmaceuticals now? Do we wanna repeat this scan in 2 years, in 3 years? Like,
Yeah.
how closely do we wanna monitor you to make sure that you don't become one of that, over 50% statistics, or just
Yeah.
not be happy with the way it turns out? And, like, as an aside, previously, people really just use stress tests to
Mhm.
to test, and maybe a calcium score, to test for coronary artery disease, and this is just we've just come so, so, so far, and then, like, if they failed those things, maybe they would go to a heart cath, which is, like, an actual procedure where you're
Yeah.
inside someone's artery, right? Like, the risk of that versus just, an image, like, we get some radiation with this image, but I'm sure you used to work in the hospital, Jeff, like, I'm sure you've
Yeah.
seen some downsides to some heart caths,
Yeah. Oh,
that
yeah.
things can happen unexpectedly and obviously unintentionally, so this is just kind of a
Yeah.
safer, in my opinion, way to screen for these things.
I agree. About the only thing you miss with this is that perfusion component, right? You can get that with a CATs. You can actually see how
Yeah,
much blood is getting past a stenotic lesion. And sometimes you may have, like you said, I sent a guy for
that's
cath
true.
after this study came back and did show like a 40-ish% lesion in his what we call the widowmaker, the LAD. Um, and sent him in. He got a cath the next week, and actually, he still had a really good what's it, the R value or the flow
Yeah,
value
yeah.
that's after it. Yeah. So his heart muscle was
That's a good
getting
call out.
plenty of blood still, but it still led us to this diagnostic test, and also opened his mind to thinking, "Wow, I'm 55. I've got a 40% lesion of this thing. Right now, it's okay, but do I want to consider taking something that's going to stabilize that and potentially even reverse it a little bit or, decrease my risk of having a
Yeah,
long-term
and that's
event?"
someone that probably would have had a very low calcium score, if at all, and
Mhm.
also someone that
Mhm.
definitely would have passed a stress test if they were getting good perfusion, right? So they would have
100%.
kind of failed. Maybe they would have had a positive calcium score, but I don't know of very many cardiologists that are gonna proceed with a heart cath from a borderline positive calcium score.
No.
So
Yeah, and I've got even one more last case I'll tell you just because I had breakfast with this guy over the weekend. I was down at Lanning, so one of my premium patients, and 46-year-old father of twins, just wonderful dude, and super busy guy in his life, neglecting health for wealth as so many people do as we're trying to
mhm.
be in our society that we built for ourselves. He had just passed a stress test because he had a buddy who's a cardiologist. He's like, "I'm gonna do a stress test," kind of getting on top of my health. He came to us after that, and it was within a year of having passed that stress test. We did it clearly, and he had bypass surgery less than a month later because he had these plaques like you mentioned earlier. When they build slowly enough, maybe they're calcified, maybe they're not quite yet calcified, but you compensate, right? We are amazing organisms that we can compensate and get past these things and still perform well on what we call a functional study, like a stress echo, but still have significant disease that at some point it's just kind of a time bomb, right? Something bad will happen eventually.
Yeah. So very cool. This is,
Yeah.
like Jeff said, also probably the most common advanced diagnostic. And it's an investment. I mean, I don't know what's going for now. I want to say somewhere between 1,200 and 1,500 for
Yeah,
patient
that's about
cost.
right. Yep,
We don't
yep.
make money on these tests, but I mean, they're an investment. But again, I mean, when this is the number one cause of morbidity and mortality, pretty much in our country, it's well, pretty much in the world, I would say,
Yeah.
is something to think about. So obviously, we started on an intense note. Um, you
Yeah.
know, let's talk about some of the more fun stuff, and then we'll maybe dive into one of the other big horsemen here in a minute. But let's talk about what some of the things that like we're using with patients, just kind of lower cost and kind of regular testing to really optimize their fitness, optimize their maybe their body composition goals, or different things like that. Like some of the ones that come to mind: Dexa, VO2 Max, CGM. These are super super common tests we run. So I don't know, what's your favorite or most common one
Do you
of
want me
these
to
used?
pick off the menu? Well, I think
Sure,
like the
yeah.
the last one you said, I think I can't think of the last patient I had, but I didn't recommend, "Hey, let's do a CGM." It's $100 investment for a month's worth of readings, and I think about, um, really, it's appropriate to think of those as, markers of blood sugar because that's really what they're looking at, the blood sugar concentration just under the skin. So we're talking about continuous glucose monitor. Um, and it really allows us to cater your diet to a what I would like to think of instead of just sugar, a lower inflammatory diet. So that we're staying in a tighter, what we call a tighter glycemic window. We're not having these big spikes or staying above a certain level for too long in the day. And we use them for diagnosis, right? Like when you see a patient who's like, A1C and fasting sugar aren't quite making sense. Let's see what's really going on here. So it can
Yeah.
be useful for that. But honestly, for my patients, I feel like just a great investment. Our health coaches are really well versed at meeting with people. Of course, our docs are too, but they can connect to your account. They can kind of coach you through the highs and lows, and really helps us to take a detailed look at the diet that you're eating and little changes we could make.
Yeah, for sure. Another area of group of patients I really like to use these glucose monitors in, especially for my gals that I work with, is like You can kind of use it as a quasi marker for stress input as well because it's going to
Yeah,
catch cortisol bumps
sure.
pretty efficiently. And so like a lot of my girls are coming to me and some men too. I mean, we have really high achieving, very active men. And
Mhm, mhm.
oftentimes that can come with some, a lot of adrenaline, a lot of cortisol, right?
Oh, yeah.
But like they're very fit, they might be fasting, like there's a lot of hormetic stressors going on. And so I think it's common in our patient population in general, but like these people will come in and maybe they have elevated average blood sugar, maybe even in the pre-diabetic range. Maybe we're seeing
Yeah,
5.7, 5.8, but their insulin's like their fasting insulin might be really low, like one.
yeah,
And those people, I'm always suspicious of this, and it's kind of cool because it can give you like actual like real time scenarios of like when is your blood sugar spiking? Is it during exercise because you're not fueling before exercise? Are you
yeah,
having like fasted caffeine every morning, which women don't tend to tolerate as well as men?
yeah,
It can kind of give you a lot of insights physiologically into what some of those stressors are. Cause I don't
yeah.
know about you, but I feel like those are easier to handle than just saying, don't stress so much.
Oh, yeah.
So
I
it's,
am I am humbled every time I put one on. I'm like,
oh yeah,
"Dang, I
I
I
know.
need to adjust
I
my
know.
eating times a little bit here." Yeah,
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 my
so
husband was one of these people. He was, like, doing all the right things and came to see Carl, and his blood sugar was, like, way higher than expected for his insulin, and he was, like, starting the day with a cold plunge and black coffee and fasting and then going to
mm,
CrossFit, and it was just, like, a bunch of stressors one after another, and, like,
yeah,
having a snack before CrossFit made a huge difference, right?
yeah,
So,
yeah,
and then with women, if you get cortisol under control in this way, which is like real time biofeedback on it, oftentimes we see huge benefits to hormones downstream as a result, because cortisol can really like block sex hormone
oh, yeah.
production,
It's a great
especially like
point. Yeah,
ovulation and progesterone.
yeah,
So
yeah,
it's just a kind of a cool way to help with optimizing fertility or perimenopause symptoms, like other things like that.
yeah.
So
That's a great point, yeah. I don't think about that one so much, but that's you're super helpful. Um,
sweet.
and then when I'm thinking
Um,
about like, you mentioned those 3 things, and I was just doing the
mhm.
calculations in my mind, I was like, that total to get a VO2 max, which is a measure of your body's ability to, burn oxygen at a high rate, um, and a Dexa scan, which is looking at our fat mass versus our lean mass content of our body, and then add a CGM to that. I was just I think that's like less than or it's right at a $300 investment probably for
Yeah,
all 3 of those things.
pretty awesome.
So, yeah, and I would say that trio is super valuable in the insight it can provide, very coachable. It gives us a lot of directions to head with your health. We've got a good idea of, fat content, where that fat lives, even more important, right? We hear about visceral adipose tissue, which I think a lot of people are hearing about in the podcast universe, and that is that dangerous fat that lays around the intestines and especially the liver that really precedes or is the cause of metabolic dysfunction, insulin resistance, this kind of bad cascade of things that happens. But then a lot of times I just went over with a patient this morning who had like zero visceral adipose tissue. But again, kind of reference the population you're just talking about, a perimenopausal female who is way under muscled. And that's like when we need to be okay. It gives us something to coach around and
Mhm.
say, look, this is a period of your life when you're at high risk for even losing more muscle, leading to osteopenia, osteoporosis, more metabolic dysfunction. So it gives us a lot of coachable insights looking at that.
Yeah, yeah, for
Yeah.
sure, and a lot of these folks too, if their muscle, like, mass is low, maybe they're coming to you frequently because 'cause they're not feeling great, but also are like, "Why can't I lose this belly fat? Why can't I g like, why is my body changing? Like, no matter how much I move, no matter how much I work out, diet, like, this isn't moving the needle." This is kind of a common story, and I have no doubt that these women are doing everything that they say they're doing.
Yeah.
And building muscle is the answer, right? So even if you see
Yeah.
that scale go up first, you've got to build muscle to then reset your metabolism and start burning fat, right? The system's not going to burn fat when you're losing muscle. It's just going to try to protect you and hold on to those calories for dear life.
Yeah.
So it can be like nice to see because it's just a lot more accurate than looking at the number on the scale of what you're working with there. So Dexas are
Yeah.
awesome. They're super low radiation. There were some X-rays, but they're super low radiation, all things considered. And obviously, they're diagnostic for osteoporosis. That's probably the most common reason people historically have gotten these, but they're super awesome for body comp
Yeah.
analysis, like what Jeff's talking about.
Yeah.
Sweet.
Yeah. And then the one that I threw at you right before we started here is like, oh, I was
Yeah.
just reading about this, so I wanted to talk about it if we're talking about longevity diagnostics. There's been a lot of attention to VO2 max over the last couple of years and how it may be a very reliable indicator of health span and lifespan. So I was doing some just background lit research this morning and trying to figure out exactly what those numbers are because you hear that if you're in the top quartile. So what this would be is a VO2 max test involves you getting on usually a treadmill or an exercise bike and having progressively higher load applied to that or incline or speed. So they're speeding up your metabolic rate, trying to make you kind of hit that max where you want to say uncle and say, okay, call it, I'm done. And then we're able to measure the output because you're wearing something that's measuring respiration and looking at the gases you're exhaling, which tells us when you switch from, burning the pyruvate cycle, which is right off, and then burning glucose and then getting into fat burning and kind of where those levels are. So we're looking at when you're maxing out at each of those levels, and it gives us a really accurate number. So the research tells us now, and this is why this is becoming so popular, that if you're living for your age in the top quartile, in other words, if your VO2 max is better than 75% of age matched people of your gender, that you definitely have some likelihood of living longer. And the most accurate numbers I could find were like 2 to 4 years. That's what they're matching up with that top quartile. If you're in the top 10%, like you're better than 90% of age matched people of your in sex matched people as well, then you're looking at a 4 to 7 years of additional life that are added to you. So that's the closest numbers I could find, but pretty profound. It's a
Yeah.
real something that really makes a difference.
That's significant. When I look at these and when I was, like, making this list, I'm thinking about it right now, I'm always, like, kinda dumbfounded at, like I feel like the things that we really end up focusing on are, like, either the most, like, technologically advanced, like,
Yeah.
coolest studies that, like, are new tech, like,
Yeah.
not fringy, I mean, it's very clear science, but, like, they're totally on the extreme on one end, and then, like,
Yeah.
getting back to basics. Like, they're the
Mhm.
extreme of technology, right? Like, very little, like, build muscle, right? Like,
Yeah.
control your blood sugar,
Yeah.
like, keep fat off of your organs. Like, this is, like, the basics, right? Like,
Yeah.
and, VO2 max, like, make sure your cardiorespiratory fit, make sure you're moving your body in the right ways, right? Like, we talk to the patients about these things all the time, but it's nice to be able to get and it kind of feels like, you could just, like, Google this and know what to do, but, like, it actually is very, very nice to have, like, these metrics to see, like, okay, is what I'm doing working?
Yeah.
Like, you can retest it in 3 months or whatever it is and see, like, did that intervention that we talked about that I've been working so hard on in my very limited amount of free time, like, did that actually move the needle for me? Is that actually building muscle up? Is my VO2 max increasing, etcetera? So, it's just nice to be able to put some numbers on those, like, simple, basic, like, ABCs of health,
100%.
and they're
Yeah.
much cheaper, obviously, which is nice.
Yeah, yeah, much cheaper and they're super actionable. I mean, if you're signed
Yeah,
up for a
for
year-long
sure.
journey with us, like you just said, we can recheck some of these things in 3 months, maybe 6 months at the most, and see the changes pretty immediately if you're
Yep,
following, some of the advice we've agreed on. So, yeah.
yep. Okay, let's go granular again,
All right.
and talk about something a little more depressing again. Uh, so we talked about heart disease. One of the other, like, probably the
This is
second
like the
leading.
sandwich method, except we're doing it backwards,
Yeah,
right?
yeah.
Instead of the good,
Uh,
bad, good, we're yeah, yeah.
so another thing, obviously, that a lot of people are impacted by, either personally or someone they love has been impacted by, just about everybody, I think, would be cancer, right?
Mhm.
Which is fueled by metabolic dysfunction and all these other things, but inflammation, et cetera, all these things we're tracking. But, like, what about, like a lot of different routes have been taken with cancer. Like, we thought genetics, like the genetics of cancer molecules themselves, like genetic targeted therapies were going to be like it, right? We thought immunotherapy was going
Mhm.
to be it, right? And, like, maybe one of these things will be, right? But how do we detect it early enough to where the treatments for cancers aren't so devastating, right? To where,
Yeah.
you're like, chemo is system-wide intense because you catch it by the time you catch it, you're stage 3, stage 4, or radiation is more widespread, or surgery is more intensive, right? Like, a lot of the morbidity and mortality of cancer is more to do with the treatments to cancer,
Yeah.
right?
Yeah.
Not always, but frequently. So just something to think about. There's two main diagnostics that we use in addition to like everyone at Wild Health gets the comprehensive labs, the genetics, and we look at you from a very personalized standpoint and it can overlap into all of these things. But like I would say a full body MRI and a Gallery blood test are probably the two most common um, advanced diagnostics that we use for cancer screenings. And obviously, a full body MRI isn't just for cancer screening; it can catch other things, like aneurysms or the other things that
Yeah.
random things sometimes.
Yeah.
But frequently, people will use it because they might have a strong family history of cancer, and they want to kind of be like extra vigilant about that. And that we typically use the company Pernuvo for that. The good news is Pernuvo does not have radiation. And, the bad news about it is that it also doesn't have contrast. It's not always the most sensitive and the most, accurate.
Yeah.
Like sometimes we get answers that are like, oftentimes when I get an abnormality, it involves, referrals for more testing is what that involves. So, it can just be a rabbit hole to go down sometimes, but I have heard some beautiful stories of some people that caught some very, very early stage, like bad things, and were able to handle it before it became terrible. So I don't know what your 2 cents are to add on that one.
Yeah, I mean, I think that we remember stories better than we do statistics most of the time, and I think you're exactly right. One of my, earliest experiences with Prenuvo was a lady, a super healthy lady I was seeing a lot over a year, and just kind of as a last-second decision within her last month of membership, she decided she was gonna stay on with us. She was, "Let's do this last thing, and we'll see." Had a Prenuvo and, yeah, found a thyroid cancer. And this lady was doing everything right. Labs looked perfect. She was doing Olympic lifting and zone 2 training and all these things we talked about. Had her Dexa, had every other test we've talked about this far. So yeah, fast forward a year later, she's still my patient. She had a successful surgery, was caught early. And man, yeah. So that for her case was a lifesaver. The caveat that I want to go back to that you've hit upon, but everybody needs to thoroughly understand, is that there is a high false positive rate with this thing, right? Like you said, we're going to find something almost always. Whether sometimes it's a little hemangioma, a little blood-filled cyst in the liver that was never going to be a problem, but we found it anyway. Lots of times we find some degeneration in the lumbar spine and the back. All of us tend to get a little bit of arthritis in our back as we age. So that's usually not an actionable thing. But as long as you've got someone like your Wild Health provider, who I feel like we're all well versed at picking out, okay, this is red flag, this is actually fine. We can keep an eye on this. So knowing that you're going into the 20 to what have you read? I've read 20, 25% like false positive or you're going to
I think
find
that's about
something, right?
right.
Yeah.
Yeah,
Like,
I would say most of my patients that get this done, something is positive.
yeah. Yeah.
I mean,
Yeah.
and I tell people before they get it, I'm like, "Look, when you go looking, this this with this much detail, you find things." And
Hmm.
it's like something I used to say in the hospital. So I might have been like a little there was like less shock and awe for me because in another world I was a hospitalist and like everybody gets an MRI, right? And like
Yeah.
we would
Yeah.
see like liver cysts and be like, okay, just keep
Okay. If
reading, right?
whatever. Yeah.
Or even
Yeah.
changes in the brain sometimes. Like it's like you just kind of get used to what's concerning and what's not. But if this is all new to you and you get this report and you're like,
Yeah.
wait, I have cysts where? Like it can
Can
be
be scary
super scary for
for
sure.
sure.
So like
Yeah.
I just always prep people of like, when you go looking, you're probably going to find something. And like,
Yeah.
if you can go into it with that mindset and that's not going to cause you more anxiety than what it's worth. And obviously, we can dig further if there's something that's concerning, and I just have like a really honest discussion with people. And some people are like, "Ooh, I don't want to know." Like, and some people like I mean, we tend to have very data driven patients, I would say on average.
Yeah.
So,
Yeah. I think so too.
most people go
Yeah.
for it.
So I can
Uh,
speak to this Pernod. I think I told you I had one on Friday. I finally
yeah.
got
Well,
my first one on Friday.
I didn't want to
No, no,
spill the
no.
tea.
I'd love to share my experience because it was like a freaking spa. It was great. I'm so used to like, the dirty dungeon of the hospital where MRIs are done or something where, or a radiation suite where it's kind of, oh, it's very sterile. And I mean, you walked in this place, amazing it's like a full barista bar over here and snacks, and then they give you your private room, and they give you your headphones and your glasses, and you're just watching Netflix the whole time during the scan, so you can
Mhm.
not listen to so it was I found it was, incredibly simple. I think MRIs can be a little bit anxiety provoking in people because you're in that little tube. You mentioned the radiation thing. There really isn't any that we gauge MRIs by their power, kinda looking at Teslas, and I think it's a 3 Tesla scan is what they use. So not like so specific that you're trying to follow up a cancer in someone that we would use a much higher powered, MRI machine, but good enough where they're gonna catch most things and be able to pick out, the good from the bad, what's
Yeah.
normal, what's not normal.
Yeah.
Yeah.
Sweet. Well, maybe I'll get one day now that I know it's a spa day.
Yeah, it's a
So
spa day. It's not quite a spa, but you know what I'm
yeah,
saying,
yeah, yeah, yeah,
for
yeah.
yeah.
Okay, and then the other cancer screening that I would say is a little less popular, but still order fairly commonly, well, maybe not commonly, but I order a number of these every year for patients. It's a Gallery test by the company Grail. So this is essentially a blood test. It's a liquid biopsy. Claims to detect more than 50 types of cancer. I'm not super clear on the science there. But I do
Yeah,
know that it's also not the most accurate. It's a little bit opposite to what we just talked about. It actually has a really high specificity,
yeah,
but like a lower sensitivity. So essentially what this means is there's going to be like less false positives, like what Jeff was saying. So if it detects a cancer, it either says it detects a cancer signal or it's, doesn't detect a cancer signal or cannot be determined. I don't know what the wording is they use for the like equivalent one, but there's like a I'm not sure answer too, which to me might be the most nerve-wracking of them all if I were to get this back. But it basically, like, if it detects a cancer cell, it's most likely that it is real, and then
mhm,
we do further digging with, kind of the most appropriate screenings and testing for that type of cancer signal that it detected. If it doesn't detect a cancer signal, it's not as reassuring. So I was doing a lot of reading on this before this podcast. I wasn't clear on the numbers.
yeah,
Essentially, as the cancer stage goes up, it becomes more and more sensitive, which makes sense, right? It's gonna have a stronger signal. So, I
yeah,
mean, if it says no, there's a 90% chance you don't have a stage 4 cancer of that cancer signal.
yeah.
That's I don't know, I don't find that
I
comforting.
don't Yeah, no, no. I think that the place where I find this useful, and I think, we've had them talk to us, right? And at
Yeah,
least I know the scientific director at Gallery, came and
yeah,
talked to us at one point. Um, th there were 2 things that struck me when talking to that person. I mean, learning that really I think this test is best if you're looking for a cancer that we don't have very good screening for right now.
yep,
So let's say you have a family history that is strong for you had a couple relatives of ovarian cancer
yep,
or pancreatic cancer.
pancreatic, yep,
This is
especially the ones that
probably
don't tend to get diagnosed until later stage like
that's
that.
right,
Yep,
exactly. So if we're talking about cancers that historically are not diagnosed until stage 3 or later, which is where we find things like ovarian, pancreatic, hepatobiliary sometimes, like, this is
mhm.
a test that we wanna look at for that because it is good at picking it will
Yeah,
find abnormal signals early.
I've also used it in patients, who might have a strong what I think is just, like, a strong predisposition to cancer. Like, I had
Yeah,
one patient, she had breast cancer in her 30s, she had a colon polyp that was pretty significant, requiring surgery in her 40s, very, very healthy gal doing everything right.
yeah,
We're optimizing everything else, but she's like, "I just wanna be like, I'm doing all the age appropriate screenings," and this, to be clear, doesn't neither of these replace those, yet. The
yes,
science just
yeah,
isn't there. It's not gonna replace your colonoscopy, your mammograms, et cetera,
yeah,
but, like, you know, it can be a great adjunct, and for people who are like, "I just believe I'm high risk," or if we tell you, it seems that you're high risk for this, like, it can be really helpful just as a piece of the puzzle, right? Like, just
yeah,
in addition to these other things, can be that extra peace of mind, especially if you're getting it kind of serially, every 1 to 2 years or so. So just another one out there. I think the science is awesome. I mean, I think it's super rad that this even exists. This is pretty new technology. And so I don't I can't speak to exactly when it came out. You might remember. But I don't think we were ordering these 5 years ago.
No, I don't think so either. I think I have a friend who unfortunately was diagnosed with colon cancer pretty early, and that's the first time I remember hearing about it was in his follow-ups. They would look for abnormal signal using a Grail Gallery test. I was like, oh, so that's in a specific follow-up situation to see that there's no more of this cancerous DNA signal floating around.
Yeah.
Another thing, the only other thing since we've talked about both the Grail Gallery and the Prenuvo that to consider, just because we want to be pragmatic and give our patients the right advice depending on their finances. I mean, the Grail is a cheaper test, right? A Prenuvo is generally going to run somewhere in the $2,500 to $3,000 range. I think the Grail you can get for like 850 or something like that. Isn't that
I
right?
think you're right. I think it's under 1,000.
Yeah. But I think like you just said, Aaron, I think if you need some peace of mind and you're doing your other normal screening, starting your colonoscopies or Cologuard at the age of 45, if you're a female, doing your normal pap smears and getting mammograms for males, maybe looking at a PSA occasionally to check for prostate cancer. Like there are screening tests that we need to continue to keep an eye on through these ages, but this can be a good adjunct to provide you some peace of mind.
Yeah. Cool. Okay, we're coming up on time, but we want to talk
Yeah.
to you guys a little bit about epigenetics, age testing, and how to kind of screen for potentially even diseases through genetics. So this is kind of newer technology even yet, and still kind of coming around, right?
Yeah.
But it's really, really cool stuff that's kind of changing in real time that we're trying to keep a pulse on.
Yeah. Yeah, 100%. I'd say one reason, I mean, this, and as you just mentioned, I've been in a leadership position here for about 2 years now, and it seems like we have had to kind of re-explain these epigenetic age tests about 3 different times because the science is changing so rapidly in the way they're reporting it and how specific they're becoming. But I think that the take-home message, the way to really understand these tests is that we're realizing is that by checking these epigenetic methylation sites, in other words, where there's an extra carbon attached to a group of these binding sites for under DNA, it's looking like that is a better predictor of an underlying biological disease process than a lab. So, just using a very simple example, most people know a fasting glucose, fasting blood sugar, or an A1C, which is that 3-month average of your blood sugars, fasted and unfasted. If we're looking at that in your serum, what we're seeing in the science now, and this is like you said, I mean, just last year, Yale made some huge breakthroughs with this using the chip that we have at Wild Health, the True Diagnostics chip. Um, we're realizing that these tests are better at detecting disease processes earlier and are probably more accurate in defining, okay, even though your A1C in your blood is 5.4, we're seeing that on this epigenetic test, it's a little bit further down the road than that, meaning that this looks like we may not be calling it a problem right now in your blood serum, but this may be on your horizon. This is an indication that it may be coming. So maybe we need to get stricter with your glycemic control. Going back to that, maybe we should wear a CGM more frequently. Maybe we should have different benchmarks for where you're hanging out with your glucose.
Yeah, so these are like super actionable for us as providers. Whereas,
Yeah.
like before, when we were just getting age testing, like how much does your
Yeah.
biologic age differ from your chronologic age? It's like a bit sexier, I think, to people
Yeah.
because you're like, I want to be younger than my, chronologic age. That's cool. And you can retest it over time. And if the
Yeah.
testing hasn't dramatically changed in that amount of time, then theoretically see if your actions are making a dent. But then even then you're like, but which action, right? But
Yeah.
here, you
Exactly.
know, we get excited as providers because like this is a perfect example of somebody that we would maybe choose to do a sooner cardiovascular screening on than otherwise, right? Like
Yeah.
if like
Perfect.
we're
Yep.
seeing some super concerning cardiovascular markers and maybe we pair that with maybe they've got an ApoE4 SNP that we've checked, or maybe they've got a strong family history, or maybe they've got a higher ApoB we'd like to see. Like we're pairing it with a lot of other real-time data and other snips that we look at. And it's just one more piece of the puzzle that's a very strong piece that's like, yeah, you know what? I know you're 35, but like I think this might make sense to do this sooner rather than later and get a hold on like making sure this isn't already happening. And then also just like where to focus your energy, right? Like people who are
Yeah.
interested in this stuff, they're busy, right? Like
Yeah.
they want to
Yeah.
know what's going to give me the highest return on investment for my
Yep.
money and my time, more importantly. And
100%.
so,
Yeah.
where do we put that energy? Because people
Yeah.
are already working on their health if they're coming to us, right? But
Yep.
like, how do we focus them on the areas that are actually going to support them the most downstream, right? Like prevent the
Yeah.
most badness and make them feel the best, right?
Yeah.
So this is just, I think, a really, really big shift in the way we're going to look at things coming soon. And already a little bit is changing the way we're looking at things. And I think this is something that kind of has the capacity. This and AI probably have the capacity to really flip some things on their heads. So we don't need to go down that whole rabbit hole, but like
Yeah.
it's just kind of rad how much we could get from this long term.
Yeah, we believe that this, may truly change the face of diagnostics. And I think you nailed it. This is a tool. This is a tool in the complete toolbox that we're building for you to maybe pick out one more area of focus where we can get more granular. And these tests, like you said, they're actually called Gen X tests for generation explainable. Because like you said, the biological age, that's just kind of hey, that's just sexy. Let's see if I can get younger than you. We don't care about that as much, but if we can explain what's changing that biological age, that's what's important.
Yep. Yeah, and
Yeah.
just kind of guides us as providers into like what where are we going to help move the needle there? What body system do we really need to hone in on? So
Exactly. Yeah.
cool.
Yeah,
Awesome.
man.
Anything that I missed, Jeff's much smarter than me, so I'm
Oh,
gonna make
don't
sure he
even.
reviews everything and
Don't even. No,
there's
Aaron,
no
come on.
testing we're missing
There's
here.
there's
There's
no
so many,
lying
I'm
on this
sure.
podcast. No, I mean, I think we hit the big ones that we use a lot, and honestly, I think a good way to think about this is kinda what you already tried to encapsulate. There are some really low cost, but high return on investment things that you can do. If it clearly is out of your price range for this year or per Nuvo, don't worry about that. Get a CGM and a Dexa and a VO2 Max and start there and just start to make those changes because it's not like you have to spend $5,000 to really, check all these boxes. Some very simple interventions that you can do with some of this more advanced testing can make huge, really profound changes.
Yeah, and again, like if you're working with us to begin with, we're going to have a lot more data to help guide you. How
Yeah.
necessary is that testing? And we're not profiting from it, so it's really simple for us to say, yes, this really I think matters for you, or maybe we can hold
Yeah.
off on this for right now. So I think it will be an all inclusive, like collaborative discussion of what is the best type of testing for you specifically, and we're not just coming off the street and having a conversation and doing that. Like we're using a lot of data to help determine
Yeah.
that just from like the foundation of things.
Yeah. I
So
do think a lot of our competitors do kind of throw the kitchen sink at you and then try to back, okay, well, this might be a problem. And I love that. We take a much more targeted approach because we've got that advantage from the
yeah.
start.
Yeah.
Yeah.
And I mean, if people have the means to do that and want to do that, there are people
Sure.
that do pretty much every single one of these tests every single year as a part of their physical. And there's nothing wrong with that. I mean, that could be the way of the future as these things become more popular, they're going to become less and less in cost, I'm sure.
Yeah.
And so there's nothing wrong with that other than maybe some radiation in one or two of the tests. But not everybody needs to do all of these, is I think your point, especially like our young, healthy folks. So
Yep.
cool.
I agree.
Awesome.
All
That's
right.
about it, guys. Talk to you soon.
Bye.
Thanks so much for listening to the Wild Health Podcast. If you want more daily health education, be sure to follow us on Instagram, which is filled with health optimization how-tos, grocery shopping lists, guided breathwork posts, myth debunking, and so much more. You can find us at Wild Health MD on Instagram.